A little bit sore, but no, we enjoy. Actually, my wife and I have been really enjoying Vietnam. So thank you for the hospitality. Thank you for allowing us to come join your university and be with you these past few days. And hopefully, as we wind down the next couple of days between today and tomorrow, you'll be able to kind of see a little bit of what we do. If you're able to come to the clinic, we'd love to have you visit and see and observe. You can certainly ask us questions and pick our brains. We're here to share our experiences, and hopefully we can instill some ideas and some pearls of guidance to help you get through your journey of implant dentistry. And so for this morning, that's New York City. If ever you visit, you're more than welcome to come visit the university, come visit our office. I usually like to take some skyline pictures of cities and countries that we visit, but you're more than welcome to come visit New York City if you ever have the opportunity. For this morning's presentation, I was asked to speak about hard and soft tissue grafting principles, hard and soft tissue considerations for implant dentistry. Because a lot of what we do in implant dentistry is not so straightforward, and I'm sure you've noticed that the past few days with the previous presentations. Implant dentistry is a very involved discipline. It's not very easy discipline to master. I don't know if we can certainly master implant dentistry because we're always learning. There's always new ideas, new techniques, and new materials that keep coming out on the market. And it's a good thing because it helps us to be a better clinician, and then it helps us to be able to provide better services for our patients. And so we learn from each other, we learn from our experiences, and we like to take these opportunities to be able to share what we've gone through. And as Dr. Claudia mentioned, some of the things that we learn the most from is our mistakes and our failures. And so that's where we gain a lot of education. So today we want to kind of go over some ideas and principles of hard and soft tissue grafting, understanding how do we simplify some of these procedures. There are ways that we can simplify some of the grafting procedures. And if we can utilize those concepts and if we can utilize those techniques, it's going to make your job a lot easier, and it's going to give the patient a better experience. And so we'll look at different clinical situations because at the end of the day, we're clinicians. We're treating patients. And so we want to use the best materials, we want to use the best techniques, we want to have the best outcomes for all of our cases. And so we'll look at some of the cases in terms of the indications and how to maximize the potential for those cases. So when we look at hard and soft tissue grafting, we have to understand why we're performing those procedures. What's the reason for performing grafting procedures? Understanding when do we have to graft? Or is it necessary to graft? Maybe it's not so necessary. So we'll look at some issues regarding when we graft, the timing of grafting, and what kind of materials do we use. There are many, many different materials in the market. Many materials, many companies. And so I'll just share my experience with what I use and what I think has been the best materials to use for my patients. And so we'll look at the timing, how long do we wait. So there are strategies that we can employ. There are strategies that we can use to help us give us that predictability. And so we have to understand when we do grafting, you may hear lectures on just hard tissue grafting, bone grafting. It's very important. You may hear lectures on just soft tissue grafting, which is also important. But many times when we look at hard and soft tissue augmentation grafting procedures, a lot of times they really have to go hand in hand. Not so much as two separate entities, but many times, more often than not, we have to perform both hard and soft tissue grafting for our patients. Because if you're looking at this picture, you can see, when you look at it from the occlusal view and you look down, there's certainly a large defect there. Right? You have that indentation. We have this concavity here, so you can certainly appreciate that there's not enough bone there. That's what it looks like. And it's not even just a bone, just a tissue. If we look at it, it's going to tell us that it's probably a mucogingival defect, right? Soft tissue defect there. So we want to understand some of the principles.
Và chúng ta
looking at
sẽ
it from
nhìn
a
vào
colorful
hình
view,
cơ
from
bản
a
ở đây rằng
photograph, you can see the defect there.
và khi mà chúng ta
And
nhìn
it's
vào
a
hình
pretty
học
large
này,
defect, and you would ask yourself, is there
Bạn sẽ
or
tự hỏi
is
bản
there
thân
no
mình
bone?
là ở trường hợp này thì
And
ở
just
ca này
by
chúng tôi có đủ
looking
xương hay không?
clinically,
Và khi nhìn
you
vào
may
hình lâm
assume
sàng
that
thì
there's no bone.
thường do cái
Right?
lượng nó
So
không có
unless
xương.
we have more information,
Nên là trừ
and
khi
we
mà
talked
chúng ta
yesterday
có
about having
nhiều
information,
dữ liệu hơn,
gathering data,
như là
getting all the information
và thu
that's
thập
going to
dữ
allow
liệu
us to plan our
thì
cases much better.
chúng ta có thể thực hiện
And so
cả
just looking at this case, it looks like there's
khi
a
mà nhìn
large
cái ca
defect
này
here
thì chúng ta thấy cái
where there's
huyết hỏng ở đây
probably not enough bone.
và chúng ta sẽ
And in many
tưởng
cases,
ra rằng là nó đang
even the
thiếu
soft
hỏng
tissue, if you
xương
look
rồi.
here, it looks like almost a soft tissue
Và đôi
defect as
lúc
well.
là cả mềm
Okay.
mô mềm nữa.
How about this case? If you
Và
look
trên
at
cái
this
ca này
case
thì
and I
sao?
were to
Chúng ta
ask
đã
you, do you think there's bone?
chúng ta đã
How
biết
many of
được
you
xương
say
bên dưới
yes?
chưa?
How many of you would say no?
Bao nhiêu
It's
người
hard to tell
biết là
unless we have
xương bên
more
dưới như nào
information,
rồi,
but
bao
if
nhiêu người
there's
là
a little
không?
concavity here,
Chúng
you
ta đã
would
chỉ
think
có
that there's
nhìn thấy
probably
là có
maybe
một
not
cái vết
enough
lõm ở
bone.
đây thôi.
Right? So this is some of the issues that we deal with. But first thing we want to do is
Vấn đề
just
ở đây
kind
là
of
gì?
clinically
Chúng
evaluate
ta
our
ở trên lâm
cases.
sàng thì chúng ta phải
Something
đánh
like
giá
this,
được
we
cả
want to
mô
look at the
cứng
soft
và mô
tissue,
mềm.
right? The soft tissue, the gingiva, and ask
Và mô mềm đó
ourselves,
chính là cái phần lợn.
is there enough soft tissue?
Ở đây thì chúng ta đã
Just
không có đủ
looking
mô
clinically,
mềm.
yes, it looks like